Okay, so what if you could figure out someone's aerobic fitness, and I mean really figure it out, without pushing them to their absolute breaking point? No crazy exhaustion, no unnecessary risk, just smart, practical science. Well, today, we're going to break down one of the most useful tools in the entire field of exercise science, the Astrand-Rhyming test.
To really get why this test is so brilliant, we first have to talk about the problem it was designed to solve. See, when it comes to measuring cardiovascular fitness, you run into a pretty big dilemma.
And this is the core of it, right? Pushing somebody to their absolute max effort can be dangerous, especially if you're in a clinic working with patients who might have underlying health issues. It's often just not practical, and sometimes it's downright unsafe. So what's the alternative? This kind of lays out the two roads you can take. You've got maximal testing. That's the all-out go-till-you-drop approach. Sure, it's accurate, but the risk factor is way higher. Then you have submaximal testing. This is the controlled, much safer path, which is exactly why it's the go-to for physiotherapists and in places like cardiac rehab. It's all about working smarter, not just harder.
And this brings us right to this really elegant solution, a test that was designed way back in the 1950s, but is still incredibly relevant today.
So the key thing to get here is that the test isn't a direct measurement. It's a really clever estimation of something called VO₂ max, which is basically just a fancy term for the maximum amount of oxygen your body can use when you're working out hard. It works because of a simple physiological fact. As you work harder, your heart rate and the oxygen you use go up in a very predictable, almost straight line. And this is the secret sauce right here. Just think of it like a simple formula. If we can control one variable, like the workload on a stationary bike, and then measure how the heart rate responds, we can pretty accurately predict that third piece of the puzzle, oxygen use, or that VO₂ max we're after. It's this beautiful linear relationship that makes the whole test possible. Okay, so we get the why. Now, let's get into the how. Let's look at the actual step-by-step protocol for running this thing. First things first, you gotta pick the right starting point. You don't want the workload to be way too easy, but you don't want it to be too hard either. This table gives you the standard guidelines for setting that initial resistance on the bike, what's technically called a cycle ergometer, and it's all based on the person's sex and their general fitness level. Now this is the magic window. The entire goal of the test is to get the person's heart rate into this specific zone and keep it there. If their heart rate stays below 125, the effort is probably too low to get a good prediction. But if you push it over 170, well, now you're getting a little too close to a maximal effort, and that kind of defeats the whole purpose of doing a safer, submaximal test in the first place. The test itself looks deceptively simple, really. After a quick warm-up, the person just pedals for 6 minutes, holding a steady pace of 50 RPM. The absolute key here is getting to what we call a steady state. That's where the heart rate kind of levels off and stops climbing. And we know we're there when the heart rate in the 5th and 6th minutes are within 5 beats of each other. That's our green light. Okay, so we've run the test. We have our data, a steady state heart rate at a very specific workload. Now for the really cool part, turning those numbers into a real, meaningful fitness score. Let's walk through a quick example just so this is crystal clear. Let's say we have a male subject. He did the test at a workload of 100 watts, and his heart rate leveled out perfectly at 135 beats per minute. All right, before we can plug anything into a formula, we have to make sure our units are all speaking the same language. The formula needs the workload to be in kilopond meters per minute, not the more common watts you see on gym equipment. It's just a standard unit for measuring work on these special bikes. So the conversion is super easy. We just multiply the workload in watts by this one conversion factor, 6.12. Our 100 watts becomes 612. Simple as that. And now we're ready for the main event. We take our converted workload of 612 and that steady state heart rate of 135, and we plug them into the specific formula for males. And it is important to know that there's a slightly different formula for females, just to account for some key physiological differences. And boom, there it is. After running the numbers, we get our final estimated VO₂ max, 38.5 milliliters of oxygen per kilogram of body weight per minute. We just successfully measured this guy's aerobic fitness without ever making him go all out. I mean, how cool is that? So, okay, we have a number, but what does that actually mean? What's the real-world impact? Why is this test such a big deal in things like physiotherapy and clinical fitness? You know, it all comes down to practicality. It's safe, it's fast, and it gives us really valuable, actionable data. For a therapist who's designing a cardiac rehab program or just assessing a client's progress over time, this test gives them a reliable benchmark of cardiovascular health without any of the risks of a max effort test. It is an absolutely essential tool in their toolbox.
Which kind of leaves us with one final thought to chew on. In a world full of high-tech gadgets and really complicated lab tests, there's just a powerful elegance to the Astrand-Rhyming test. It strikes this perfect balance between accuracy, safety, and efficiency. So when you think about assessing fitness for most people, you really have to ask yourself, is this the most practical test we have for the real world?